My name is Angela Thomas Jones, and I'm the co-founder of the North Country Task Force on Improving Opioid Treatment Outcomes. And several of my colleagues that are active on the task force are here, and I'd like for you to stand up, please, so people can see you, or raise your hand, because you can find out more information about Sally, that would be you, about what the task force is doing. What I'm going to do now is try to stick to the script because I want to respect the time. First, imagine you're on an airplane. The flight attendant is going through the emergency procedures, and they say this: in the case of an emergency and the oxygen mask drops down, put the mask on first. Then you can help others. That's the bottom line goal. The essence of the task force is about self-care for those of us who are doing this work. This work, meaning everything that you've already said, Melanie. It's a calling, this work. Okay, back to the script. Over the past 25 years of my career treating behavioral health and substance use disorders, I've maintained a private practice called Solution-Focused Therapy in the North Country. I was born and raised in Southern Virginia, been here 30 years, still sound like this. I've completed specialized training in trauma-sensitive practice and yoga applied therapy. I've also had the honor of holding leadership positions in the Department of Corrections and a large treatment center for recovery support services. During the course of my career, I've not just seen the strain or moral pain, but I've also witnessed and lived it firsthand these past several years in my chosen field of practice. And I recently heard, in fact, I think it was Sue that sent me this YouTube clip where a physician is screaming expletives about, let's stop using the word compassion fatigue, vicarious trauma, and stress. It's moral injury. Moral injury. That feels true for me. In 2015, one of my close colleagues lost one of their adult children to a heroin and fentanyl overdose. Several months afterward, this colleague confided in me their plan for suicide. Soon after, another colleague confided in me their decision to leave their practice altogether to do less stressful work. In 2016, my private practice began to grow with clients from various helping professions seeking help coping with the excessive workloads due to the workforce shortage and the increased moral dilemmas that come with that. Many of those stressors being involved with the opioid overdoses. Then during the winter of 2016, I began considering suicide for myself. By the end of April 2017, I was convinced my plan for suicide was the right thing to do. The day I was walking to the site I had selected to carry out this plan, I'd forgotten that my border collie, Panda, was with me. She's a registered therapy dog and has been going to work with me for several years, every day, so she's like my shadow. She paced herself ahead of me and positioned herself in such a way that only a herding dog knows how to do. I had to stop. She was not going to let me pass. And it was because of that she helped to save my life that day. Knowing the barriers to immediate inpatient psychiatric treatment here in New Hampshire, I sought care in Vermont. And within a few hours, admitted myself into psychiatric care for 4 days and 3 nights. My sister in Virginia and I had been speaking daily for over a year because we were dealing with significant family life transitions. She calls me, "Hey, what are you doing?" "I'm in the emergency room." "What's going on?" "I wanted to kill myself." She had no idea. We'd been talking together every day for over a year. No idea. That was the beginning of my second recovery. I'm also a person in long-term recovery from cannabis and alcohol substance use disorders, 30 years recovery. In my recovery, I've chosen to take action in this late part of my career to go upstream and identify possibly core competencies that can better equip my colleagues coming into the field with how to face the moral dilemma. In January 2018, I delivered the results of a survey my colleagues and I designed and distributed in the North Country. 96% of the respondents met at-risk criteria for compassion fatigue, and nearly 50% identified they weren't talking about these symptoms, either because of fear of a poor work performance evaluation or losing employment security. And nearly 70% believe that patient safety was often compromised due to the workforce shortage. On a national level, a parallel process has been happening. The National Academy of Medicine released a follow-up report to the 1999 publication To Err is Human, ERR, To Err is Human, Building a Safer Health System. And in that publication, it identified data that showed that a large number of hospital deaths are due to medical error, not because of irresponsible bad workers, but because of good, responsible workers working in a bad system. And that kicked off 20 years of research to identify in 2017, the National Academy of Medicine launched their national call to action for clinician well-being and resilience. And in the fall of 2018, many of my colleagues came together and formed this task force, and we aligned our goals with the National Academy. The challenge I'd like to leave you with requires you to think back to the oxygen mask, putting it on first before you can help. Here's the question: how will you help workforce development embrace our humanity without expectation of self-sacrifice? In other words, what will you do to create a work culture that validates self-care? Thank you.